How does substance abuse cause impulsive criminal behavior? Imagine a person who acts on sudden urges without thinking about the consequences. Now, picture how drugs can turn that impulse into a dangerous act. When someone uses substances like alcohol, cocaine, or heroin, it changes how their brain works. These drugs affect the brain's reward system, especially the pathways that use dopamine, a chemical that makes us feel pleasure and motivates us to seek rewards. When these pathways are disrupted, people may feel an intense craving for drugs, making them act impulsively to get what they want. Chronic drug use also damages the frontal cortex, the part of the brain that helps us control impulses and make rational decisions. When this area is impaired, resisting temptations becomes much harder. That means a person might lash out violently or commit theft just to get money for drugs or to avoid withdrawal symptoms. This loss of control makes impulsive crimes more likely. Addiction creates a cycle where the need for drugs takes over a person's thoughts and actions. They might ignore social rules or moral values because their focus is solely on satisfying their craving. This can lead to illegal activities like shoplifting, drug dealing, or even assault. The urgency to feed their addiction pushes them to take risks they normally wouldn't consider. Many people who abuse substances also suffer from mental health issues like anxiety or depression. They might use drugs to self-medicate, but this only provides temporary relief. When the effects wear off, they often feel worse, which can make impulsive behavior even more likely. In the world of criminology, research shows that people with drug use disorders are more prone to violence and other crimes. This is true for many different drugs, including stimulants, opioids, and hallucinogens. The common factor is that these substances increase impulsivity and aggression, making criminal acts more probable. Young people are especially at risk because their brains are still developing. Their decision-making skills are not fully mature, so experimenting with drugs can quickly lead to impulsive crimes. Family and social environments also play a role. If someone grows up in a chaotic or neglectful setting, they might turn to drugs and crime more easily. In criminal justice systems, addressing substance abuse is key. Simply locking someone up doesn't fix the addiction or stop impulsive crimes linked to it. Many offenders relapse after releases because their brains are still affected by drugs and environmental triggers. Combining addiction treatment with criminal rehabilitation helps reduce the chances of repeating these behaviors. To sum up, drugs impair brain areas responsible for self-control, create a compulsive drive to seek substances, and foster a mindset focused on immediate relief. This combination makes impulsive criminal acts more likely, especially when the need for drugs outweighs the fear of getting caught or facing consequences.